Warthin's tumor. Warthin's tumor, also known as lymphomatous papillary cystadenomas, are benign, sharply demarcated tumors of the salivary gland. They are of lymphoid origin and most commonly arise from the parotid tail. They may be bilateral or multifocal in up to 20% of cases and are the most common neoplastic cause of multiple solid parotid masses. Epidemiology. Warthin's tumors are the second most common benign parotid tumors and represent 10% of all parotid tumors. They are the most common bilateral or multifocal benign parotid tumors and they typically occur in the elderly, that is, the sixth decade of life, and are twice as common in men. It has been associated with smoking and irradiation. How do Warthin's tumors present? Patients typically present with painless parotid swelling and they tend to favor the parotid tail at the level of the mandibular angle. In less than 10% of cases, they are found elsewhere, including the submandibular glands, cervical nodes, and ectopic nests of salivary tissue. Example, larynx, maxillary antrum, oral cavity. Example, the lower lip and buccal mucosa. Radiologically, they are often multicentric and are usually small, 1 to 4 centimeters, and they have typically heterogeneous appearance on all modalities, often with cystic components. The tendency to undergo cystic change is greater than any other salivary gland tumors. Treatment. They are benign with an extremely low incidence of malignant transformation, and therefore some advocate surgical excision while others favor conservative management with follow-up imaging. The most common surgery is a superficial parotidectomy and the recurrence rate is low, which is less than 5% in one of the largest published series. What are the differential diagnoses? They include pleomorphic adenoma, other salivary gland tumors, namely mucoepidermoid carcinoma, adenoid cystic carcinoma, acinic cell carcinomas of salivary glands, parotid node metastasis, parotid non-Hodgkin's lymphoma, Sjogren syndrome, benign lymphoepithelial lesions, infiltrative lesions. Now let's have a look at the CT. Now classic appearance is a well-defined heterogeneous solid cystic lesion within the superficial lobe of the parotid or the parotid tail. They are well-defined without any calcification and cystic changes appear as intralesional lower attenuation with moderate enhancement. Presence of a mural node is strongly suggestive of Warthin's tumor. I repeat, presence of a mural node is strongly suggestive of Warthin's tumor and often they can be seen bilaterally. An overview of Warthin's tumor.